Hey, just another quick update. Well, actually, it's not going to be quick at all. It's a couple interesting things today. So, first off, found a new movie. It's called Kung Fu Dunk. The previews looked something like Kung Fu or something like Shaolin Soccer, but I don't know if it looks that funny. It looks halfway serious, halfway weird, but I'll let you know how it is. And also I just got back from the grocery store, and it's kind of a side thought, kind of a cool experience buying fruit off a street vendor. It was like a 30-second process, which is kind of nice and refreshing after you know, like years of going in the grocery store and being like, oh, there's this company and this company, let's look at the ingredients, oh, this one's organic, but this one's local, blah, 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 blah. It was really kind of nice to be like, I want that fruit. Well, I want this money. Here's your money. Here's your fruit. Thank you. You know, it was like seriously, 30 seconds. It was a little bit refreshing. But anyway, I just threw that in there because I don't want to do like a whole video on a tiny little rant about fruit. What I did want to go on about today is my medical exam, which I got out of the way today. And as proof, you can see my little needle mark where they took my blood. For such an experience, it was both surprisingly invasive. I never knew they'd want to know that much about my body, but at the same time surprisingly comfortable. Like it wasn't that bad of an experience, except for the whole, you know, needle thing. As you all know, I'm not a big fan of needles. So it's really interesting. You go into a hospital. It was a nice and clean hospital. You know, for China, it was actually fairly Western. Everything was up to date. There was no cracked tiles and crap. Everything was very clean and sterile. The only thing they were missing is, you know, how the West has recently kind of had this thing with trying to make hospitals really comfortable, having like waterfalls in front and like a fish tank, and this one didn't really have that going on, but still, it was very clean, very modern, very nice. So 4 of us went in with with the driver of the guy who's been helping us out. The driver spoke no English really, but he knew the process. So he took us in, and we had to give him our passport, and they gave us paperwork, and we gave him 3 passport photos. I don't know what they needed those for, but one got attached to our paperwork, and the other 3 went, who knows where, somewhere into the giant bureaucratic machine. So we got the paperwork, filled all that out. We get called in, and they give us a robe. So you have to go change. You can leave your pants on, but you have to take everything off, bra and top. A couple of the girls apparently had an awkward time with that later on. But yeah, for me, shirt comes off, robe on, everything goes in the locker. Keep your shoes on, actually. So they have you take your shoes off to your weight and height, put the shoes back on, and then you get those little like surgery elastic cloth things that you put over your shoe, and you can keep going. So then you go all the way down this long hallway with all these doors, and you get to the very end, and of course, first thing, I come around the corner and I see the needles and the blood. And so there's 2 women, and they just sit at a desk, and there's like a nice soft pad. You put your arm on the pad, and it's just like this automatic process for them. It's like, you know, person sits down, take the paperwork, attach the labels to the containers, rubber band goes on, find a vein, put the needle in, fill up 1, fill up 2, cotton on, needle out, sit over there. Next, take the paperwork, open a new needle. I did watch that. They opened a new needle. You know, open a new needle, needle goes in, etc. It's just, they do it over and over again. I can't imagine what it's like, you know. Like, what do you do for a living? Oh, I'm a teacher. What about you? Oh, I stab people with needles. You know, it's what these women do all day long. They stick someone, take their blood, file it away. Stick someone, take their blood, file it away. So, you know, I had to go in there and sit for about a minute and watch it happen. It was like, but again, very clean, nice soft pad, I guess. And it was surprisingly easy. I kind of watched it go into my arm, and it's ridiculous how easy a needle just kind of passes into you. And she actually got a weird angle on it, so I could kind of see the needle through my skin like start to pull up as she started to like kind of like get an angle to get the blood flowing quicker, I guess. It was simultaneously disturbing and curious. But yeah, needle comes out, you sit there a little while, wait for it to stop bleeding, give you a band-aid, give you your paperwork back, off to the next room. I knew that was coming because they told us not to eat breakfast, so no big surprise there. But there were a couple interesting ones coming up. Next to was just a simple eye test, you know, left, right. I looked up my nose for some reason too, but seemed he was fine with that because he just moved me on. Next was an ultrasound. So you go in behind like a paper thin screen, shirt off, which is where the girls were a little bit not so keen on it because you know, I pretty much hang out around the apartment with my shirt off because it's so hot, but the girls felt really awkward back there, I found out. But for me, you know, you lie down, shirt off, and check for all your major organs, basically. Heart's there, right shape, liver's there, right shape. Took a man. That lady was really funny too because she knew what school we were all coming from. Apparently her grandson's in 3rd grade, so I might actually teach her grandson. But she was funny and tried to talk to us the best she could. And especially interesting because one of the girls that was with us had a genetic disorder where her blood caused her spleen to try and suck up all the blood because instead of having donut-shaped red blood cells, they're spherical. So the spleen freaked out and tried to suck them all up. So basically every organ she could possibly live without is gone. There's like no spleen, no gallbladder, chunks of the intestine, I think. I'll have to ask her. A bunch of stuff. So she had all sorts of trouble with the ultrasound lady because the ultrasound lady was like, spleen. And she's like, yes, spleen's gone. She's like, gallbladder? Gallbladder? She's like, yep, gallbladder's gone. And she actually had to spend extra time as she went from further on, someone pokes you to like feel how your organ shape and all that is. So she went from the poker back to the ultrasound, back to the poker, back to the ultrasound as they tried to figure out what she did and did not have. So she had a hell of a time with that. So ultrasound, then over to chest x-ray. Took a chest x-ray. I don't know what they needed to look at that they didn't already see with the ultrasound, but I wasn't so keen on that, but what can you do? I don't like extra radiation going through my body, but you know, that was in there. So chest x-ray, got out of the way. Let's see, what was the next one? Then I'm sure I'm skipping at least one in there, but those were the major ones. Yeah, then you go in, a guy with better English asks you any major injuries, takes your blood pressure. Oh, EKG, I knew I skipped one. Go in, EKG, so stick you up heart monitor. I just had one of those a few months before I left, so no surprises there, and I was very happy to find out my heart rate is still ridiculously low, resting heart rate. Because in Boulder, your heart rate, I had one in Boulder, your heart rate's supposed to be between 60 and 80 or something like that, beats per minute. And when I had my EKG in Boulder, I actually set the machine off with like a warning signal because I was at 59 and you're not supposed to be below 60. But they're like, no, we talked to you about the kung fu you do at your athletic level. That is totally normal, and that's great. So that's cool. And this machine I didn't set off because I was exactly at 60, so I wasn't below. Which is too bad. It would have been fun to see if they freaked out about that. And then I went for my blood pressure, and blood pressure was actually at 59 beats per second, but that was just a guy looking at it, so no warning lights. But then that guy takes you behind the screen, poke, 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 everything looks fine, checks the glands and all that, and then back to the dressing room, put clothes back on, and out of there. Whole thing took about an hour. Yeah, just surprisingly in depth, what with the EKG and the X-ray and the ultrasound, but got out of the way pretty easy. My company paid for it because that was part of the contract, which is nice because it was about $100 US. And yeah, that's out of the way. So I'm here. Got that all done. Find out the results soon. I guess on some level I'm kind of happy that I get to find out if there's anything so wrong with me that China doesn't want me here, so I could take care of that now. But honestly, I think I passed all of it with flying colors. I think I wouldn't have known if something was actually wrong with me. And yeah, guess I'm done and here. Interesting experience. Very strange. So yeah, also, this is my second day teaching. I'll tell you about the first and second day some other time, but I don't want to have you guys have to watch like a 20-30 minute video because the teaching is a whole nother set of experiences, and I can see this has already been going for 9 minutes and 30 seconds right there. So yeah, teaching video later on.